ಏನೈತಿ ಪೂರ ಆರಾಮ್ ಅನ್ಸತ್ತಲ್ಲ, ಏನು ಪ್ರಾಬ್ಲಮ್ ಇಲ್ಲ. ಓಕೆ.
So good morning guys. Today we'll discuss, you can see this video that I show you before and after the video. So she is a 18-year female patient. She presented to the hospital with complaining of her history goes like she was studying in the hospital. She was studying in hostel. So during hostel she suddenly developed the chest pain. So chest pain followed by some breathlessness. After that she was having some stiffness of the body. So outside there are some people, they told that she is having this much stiffness of the body, and there are some directly will diagnose by seeing that condition, like bowing like the body, opisthotonus condition. That what is meant by opisthotonus? Opisthotonus is nothing but bow like structures. Body is bending like a arrow bow. So this condition is called an opisthotonus. By seeing this condition directly, there are some people who will directly diagnose towards the, it may be tetanus condition. She may be having some old wound, or she had not taken TT injection. Because of this condition she may develop now tetanus infection. So exactly directly labeling the tetanus, it's not like we have to go deep into this, and we have to see the any differential diagnosis. So we'll discuss the differential diagnosis in this condition. So you can see her condition goes like, first she developed a chest pain followed by some breathlessness. After that stiffness of the body and abnormal condition. So she was conscious and well oriented. You just see that what are the causes of chest pain in this condition. It may be if it is a hit, if it is any hit or any cell fall, there may be a tenderness in the chest region. If it is a tenderness in the chest region, that pain is worsening with the respiration and cough. So that pain aggravates. If the patient is having take the deep breath, there will be some rub like pain. So if it is the same thing, so this condition is usually seen because of the rib fractures condition. In patient of what you have to ask is, first you have to ask the history. If she having any history of cell fall, any hit, any assault condition, there will be a rib fractures, mild hairline rib fractures, that leads to some pain of chest pain. That pain will aggravate with the respiration, any cough or any of the chest movements. So because all these conditions, if the patient is having chest pain, so what you have to think is, we have to think of rib fractures. So one more condition is, next condition is costochondritis. What is meant by costochondritis? There may be a costal inflammation in the region of the costal margins. This may be associated with history of cell fall, any hit, or it may not be associated with this condition. Usually it's the patient is not having any history of cell fall, not having any history of hit, not having any history of any assault condition, even though they will develop an costochondritis. Costochondritis is nothing but there will be inflammation between the costal margins. Though this condition also present with the same symptom. So what are the symptoms? Same, chest pain that is increased with the respiration or any chest movements. So one, we have to see that rib fracture. One more is costochondritis. One more condition is, you have to see if the patient is having sudden, if it is a not sudden onset, it may be having since 3 to 4 days. She was having chest pain in the lower zones, and it may be worsening with the respiration. If the patient is having any active respiration, there will be worsening of the pain. After that 4 to 5 days, along with this condition, she also developed some features of fever, cough, cold, and after 4 to 5 days or 1 week, their chest pain is completely reduced. If it is there, means we have to think towards the pleural effusion. So how we'll think towards the pleural effusion is, in the mild case of the pleural effusion, there will be a small collection of the pleural fluid in between the pleural spaces. Because of this condition, there will be a pleural rub, and the patient is taking a long breath, there will be a pleural rub. Because of this condition, she may develop the pleural effusion if it is a mild case. In the moderate case, like patient is having more pleural effusion, means there will not be a rub between the pleura, because of there will be a collection of fluid in between them. So in early cases of the pleural effusion, she may develop this kind of the pain, and the associated symptoms is she having cough, cold, and the fever. So in this condition, she is not having any cough, cold, fever, and she is not having this history since 4 days. So she develops sudden condition. So this is not a pleural effusion. One more thing is, if the young patient present with this condition, there may be one more chance. If the patient is studying in a hostel in the poor nutrition supplement, there may be calcium deficit, calcium problems, like if the patient is having hypocalcemia. So in the patient of hypocalcemia, they will present with the numbness of the limb, numbness of the body, and sudden onset of mild dry breathlessness. What is meant by dry breathlessness? Breathlessness associated with no desaturation. Saturation, if the patient is present with this condition, patient will breathing like having breathlessness problem, and if we check the saturation will be normal, and saturation will be 100. Patient is hyperventilating. This condition is called as hyperventilation. So in this condition you can suspect some hypokalemia because patient is having hyperventilating and saturation is normal. She is complaining breathlessness. One more thing is, if it is a hypocalcemia, we have to see the two signs. One is Trossier sign, one more is Charpit's sign. So if these two signs were there, means it definitely goes towards the hypokalemia. You have to give calcium and some sedatives, patient will be normal. So one more thing is cardiac reason. So 18-year female patient, there will be no cardiac reason. No, this is not, because nowadays even at 20-year also they will present with MI. So what you have to do, if it is a cardiac reason or angina condition or MI anything, so they will present some history. Sudden, it may be a sudden onset with sweating, huge sweating, perfusion, and the patient will have some palpitations and syncopal attack. There will be changes in the vitals like hypotension, tachycardia, anything. So in this patient, she is not having any sweating, anything. So she is comfortable. Only tenderness is there. In cardiac reason, there will not be specific tenderness. If it is a non-cardiac, there will be tenderness. It may be rib fracture, there will be tenderness. We have see the rib fracture, costochondritis, pleural effusion condition, cardiac condition. You can see. We'll discuss about the tetanus. So what is meant by tetanus? Tetanus is nothing but it's an if the patient is, we have to ask the history. If the patient in recently 1 to 2 years back, if the patient is having some CLW, so every CLW will not, if the patient is not taking TT injection, it will not cause a tetanus infection. It will purely depend on the soil. So you can see that in patient will develop in the abrasions like road traffic accident. There may be a mud will be formed. In this mud there will be tetanus infection. So because of all these conditions, if the patient is not taking that TT injection, she may gradually develop this opisthotonous condition and hypocalcemia type of condition. So with this you have to rule out. And one more thing is, what you have to rule out is, we have seen all this condition. One thing is, we can next what you have to do is dog bite. I also keep in mind. So what do you mean by dog bite? What will happen in the patient is having dog bite? They are not taken any vaccine, Rabipur vaccine. If they are not took, they may develop this condition at sudden onset. The patient will develop along with this condition. There will be another two signs: hydrophobia and aerophobia seen in the dog bite. So what is meant by hydrophobia? Hydrophobia is nothing but if you tries to give some patient is if you given some water, there will maybe dysphagia, or patient will have some phobia condition, like he will scare of drinking water, and if you give some air, that also he will scare. How it will happen is, it will happen in the dog bite because of the meningeal irritation, because as the dog rabies infection, they will cause and lose meningeal irritation and laryngeal spasm and the pharyngeal spasm. Because of this spasm condition, they will be having some aerophobia and the hydrophobia. One more is, we have to extra think that patient may be having some meningitis condition. So how is the meningitis will present with? They may be having neck stiffness and sudden onset of vomiting, that is projectile vomiting, headache, severe headache, and altered sensorium, or any of these conditions. And one more thing is, we have to, in this meningitis, there are curling sign and the Brodzinski sign. So these are the two signs seen in the meningitis. So broadly, we'll discuss totally in a nutshell. We'll discuss the total causes. First is rib fracture. One more is costochondritis. One more is pleural effusion. One more is any cardiac conditions. One more is any tetanus infection. One more is any dog bite infection, and it may be a meningitis condition. So this is a wide range. If it is not matching any condition, we have to label it as an hysteric condition and the psychological condition. What is meant by hysteric and psychological? She is 18 years. She is studying in a hostel. Her exam is near to come. So she maybe develop some phobia towards the exam. There may be any problem in this family history. We have, if the condition is not matching anything, we'll discuss if it is not matching anything, we should label as an hysteric chest pain or the psychiatric condition. So for the chest pain or any condition, we have to go for the ECG, and for the costochondritis condition, we have to diagnose for the chest X-ray. And one more is, for any WBC infection, meningitis, anything, we have to do for the lumbar everything examinations, and CSF study we have to do. So depending on infection condition, we have to advise the investigation, and we have to treat accordingly. Thank you.